Biggest question for parents, when do we expect vaccines for children under 12?
As for when there could be an authorized vaccine for these younger kids,
an optimistic forecast is by the fall, but it may not be to the end of the year.
Well, right now we have emergency use authorization for the Pfizer vaccine for children 12 and up. It really is important for them to get immunized for several reasons. The first is, of course, that it protects them from COVID. What we've seen with the mRNA vaccine for the 12 and up is that it's very safe, highly effective. The immune responses have been really impressive. So kids are doing better than adults in terms of responding to the vaccine. There have been this rare but concerning side effect that has been seen more common in boys than in girls, which is a myocarditis. The cases of myocarditis are rare. Most of it has been quite transient. When you look at COVID compared to other vaccine-preventable diseases in kids, think about a disease like flu that we do immunize kids for to try and prevent a loss of life. COVID is very comparable to that. Second reason, once children are fully immunized, they can really resume normal activities. We know so much more about the toll that COVID has taken on children. Developmental, educational, emotional, mental health challenges. The third reason, we still have many parts of the country where the coverage rates are not high enough in adults and where there's ongoing transmission. Adolescents in particular can play important roles in those transmission dynamics. Trials are underway right now for the children under 12. They're not as large as the original efficacy trials. And the reason for that is we already know the vaccines have efficacy. So what you're really looking at is the immune responses. We are not out of this pandemic yet at all, but the vaccines are our way out of this.